Of course, I'm a psychiatrist, and I have addiction as one of my specialties, and so I see a fair amount of people that have addiction with cannabis, and I think for some people that's even controversial that you can be addicted to cannabis, but we see it every day. So I tend to see people that probably are in the overuse side of the spectrum, and it tends to dominate their life and their like with any addiction, your world starts to kind of orbit around the use rather than the use being something that's supporting your other activities. It becomes your primary activity. Also in psychiatry, I see a fair amount of people who prefer cannabis for things like anxiety or their depression or whatever psychiatric disorder. Those are probably two of the most common I see. One of the biggest concerns is its relationship to schizophrenia as a disease. And let me tell you, schizophrenia is one of the most devastating mental illnesses that we see. So there have been numerous studies that indicate that it does have a correlation with certainly earlier onset of schizophrenia, but possibly even causation of schizophrenia. Very frightening. So many people that I have seen as patients have indicated to me they use it and it helps with their anxiety. It is somewhat interesting because THC was one of the chemical compounds they used to stimulate panic so they could study panic. So yeah, there is certainly some cross messaging there. So I do think that, and again, in small amounts, it probably does have that initial effect. But if you, again, look at the effects of cannabis in continuous or larger doses, it does seem to stimulate anxiety and panic. And particularly, as I said, once you get to that, if you get to that addicted state where your life is revolving around it, well, now it's a different kind of anxiety. It's about obtaining and using and smoking. It's like any other addiction. It begins to control your life rather than helping you to control your life. So I think there are significant concerns about cannabis use and anxiety. In spite of the fact that it's a controversial substance, that many people support it, many people will report they've had, great benefits from it, we need to be just as outspoken to say, but it is harmful to anyone who is young enough to have a developing brain and should be avoided at all costs. I don't think we've been strong enough in our opposition to that, our concern about that. So I think that's it's education.